We'll start now. Dear athletes, dear coaches, ladies and gentlemen, welcome to this webinar. My name is Carlos Roy. I am General Affairs Director for United World Wrestling. I am glad to introduce and moderate this webinar, which has the title, How to Cope with COVID-19 and How to Prepare the Return to Wrestling. Today's speaker is Dr. Babak Shadgan. Dr. Babak Shadgan is the chairman of the Medical Prevention and Anti-Doping Commission. It would be too long here to present Dr. Shadgan's entire CV, but in summary, Dr. Shadgan is a doctor of medicine. He holds a postgraduate degree in sports medicine and a PhD in the area of muscle biophotonics. Dr. Shadgan's been a member of the UWW Medical Commission since 2003. So we're about to start. So just before giving the floor to Dr. Shadgan, I remind you that all your microphones are muted during this session, but you will have the possibility to ask your questions in writing at the end of the presentation. So without further delay, I will give the floor to Dr. Shadgan.
Hello, everyone. Thank you very much, Carlos, for the introduction. And it's a pleasure to present this webinar in our family of United World Wrestling. So I don't know if you have my video, Carlos.
You don't have yet your video, Babak. Maybe you can click. Okay.
Right. No, it's very beautiful. All right. So yes, I mean today's talk is about COVID-19, and we all know why it's so important. This condition currently affected everything, including our sport. And the first thing, in order to better manage and control everything under this situation, is to have some practical information about the condition and start looking at possibility, options, protocols, and the managerial decision that we have to do. And for athletes, coaches, team doctors, trainers, to understand how to deal with this condition. Hopefully we can come up with some unified international decisions that help every one of us. So I would like to continue by sharing my screen. So,
at the bottom of the page, you have an arrow, which means share the screen.
All right, I try to find my presentation here. So just a second. Okay, here we go.
We can see it, yep, perfect.
All right, beautiful. So the title is How to Cope with COVID-19 and How to Prepare Returning to Wrestling. On December 31, 2019, the World Health Organization, WHO, was formally notified about a cluster of cases of pneumonia, a new kind of pneumonia seen in Wuhan city in China. And then the WHO declared the outbreak a public health emergency of international concern on January 13 of 2020, and a pandemic declared on March 11 officially. And as you know, from that time, COVID-19 is an ongoing pandemic. So COVID-19 basically is a new infectious disease caused by the new kind of viruses, which is called coronavirus. And the coronavirus is because of its specific shape, which is like a crown. This group of viruses, the coronaviruses family, are seen vastly in different animals, including bats, which seems to be the origin of this kind of coronaviruses that we see these days. So they are inside the animal's body without any problems. But in humans, when a human is infected by this virus can cause a very critical disease. Basically, it can actually cause a disease, a kind of specific pneumonia, ranging from a common cold. This is the condition that about 80% of patients experience, to severe acute respiratory syndrome, a critical condition that we see in the rest of the people, affected people. Basically, coronavirus, this virus invade and enter through the lungs. And because the virus is a very small object, smaller than any kind of tissue cells, this virus can go penetrate into the cells of the tissue, which are the lung tissue, and starts to disrupt the cell and basically kill the cell. So coronaviruses invades human body, mostly from the lungs, and start damaging the tissue and disrupting organ functions one by another. So this virus infects lungs, as we know, and starts to kill and damage the alveoli tissue. And this tissue, as you can see here, are the terminal part inside the lung where the oxygen and CO2 can be exchanged. So when this tissue, this very sensitive tissue is damaged, the capacity of gas exchange would be disrupted. And basically what's happening is that body cannot actually take enough oxygen. And we know that the oxygen is the critical element for all cells across the body in order to survive, basically, and do their job. So what's happening is that gradually the patient shows respiratory symptoms, cannot breathe well, and even with the best effort, the body oxygen level starts to reduce. And after a certain threshold, if body cannot control it, if immune system cannot control the situation, what's happening is that this condition starts to affect different organs, each by each, and start to shutting down the organs. And this is the time that the patient cannot survive. So as you can see here in this 3D MRI, this is the kind of sickle that we see around the affected area inside the lung. So these parts, as you can see, they are damaged parts of the lung. And the main difference between this pneumonia and the other pneumonia, like the influenza or different kinds of common cold that we have seen, is that the tissue which is damaged by this coronavirus, they actually cannot be repaired. So basically, a part of the lung which is damaged by this virus is going to be lost, and it can't be repaired. That's the problem, main problem. So the common symptoms, the classic symptoms basically of COVID-19 starts with fever. So about 88% of people, affected people, experience fever. Then they start to actually show respiratory symptoms, which is dry cough, They feel sore throat. They got headache. They feel a general fatigue, shortness of breath. So they start to feel a pain on their chest. Although the best effort, they cannot actually get enough oxygen. So they feel a respiratory distress. Congestion and runny nose, muscle and body pain. Interestingly, nuisance of losing the taste or smell, and vomiting are among the classic and common symptoms that we see in patients initially. Also, there are some other acquired symptoms. They are not common and we don't see them in all patients, but lots of patients, maybe they can actually show this disease by one of these symptoms like diarrhea, vasculitis, which can affect all body. And as you can see here in this eye, it can actually show itself as a red eye. Blood clots, memory loss, ataxia, and imbalance. Many people, especially elderly, they come to clinics with just ataxia and imbalance. They can't actually keep their balance and walk, basically. And after doing investigations, we see that they are infected by this virus. Some people just show very unusual fatigue, severe loss of appetite, and the loss of taste and smell are among other symptoms. So this information I'm presenting is updated on July 11, so 2 days ago, on the website of WHO. So this is a map of infected places based on the severity of the condition right now. You can see the area with the highest rate of virus and severity of the epidemic. And so far, about 12 million, basically more than 12 million people are confirmed that affected by these people worldwide. And this number should be, in reality, should be much higher, basically, than this. It's the official number that we have. Many people are getting affected by this virus, and they are not referring to clinics, hospitals, so we don't have their statistics. This is the confirmed cases, and you can see starting from February to March, April, May, June, and now July. Unfortunately, as you can see, the rate and involvement with this COVID-19 disease is increasing. And this is the rate of death. So far, more than 500,000 people are officially actually died because of the COVID-19 during the last 4 months. And as you can see here, it started from February, got a maximum in around April, May. And this is the overall worldwide statistics. And it started to show a reduction, but now it's at the time that we have to observe. Basically, we don't see a decrease. And on the other hand, the rate of death is less than rate of infection, basically. And it may represent the fact that now we are better, our clinicians are better equipped with information and knowledge on how to deal with at least a part of infected people. And this is the rate of involvement based on the geographical parts around the world. And as you see, the highest rate currently right now is in America, in North United States, and in South America, Brazil basically are showing the highest rate of infection. Still, we see increase in Europe and other continents. So this is a real ongoing pandemic condition. Who are at higher risk of this disease? Basically, elderly people, especially more than 50 years and especially more than 70, they are at higher risk of getting infected and suffering from severe conditions and complications. People with immune system deficiency are among the vulnerable people. People with chronic disease and conditions, in particular, people with diabetes, people with disease like MS, multiple sclerosis, people with liver dysfunction, cardiac dysfunction, and any kind of chronic disease, arthritis, different kinds of chronic disease, they are vulnerable. People with respiratory conditions, those people who are suffering, who have been suffering from asthma, from chronic obstructive pulmonary disease, or people with spinal cord injury who has some ventilatory conditions, they are at higher risk. Overweight people, people with BMI more than 30, they are among high-risk people. And people with fatigue, people with overload, and people with overtraining, in particular athletes basically who are overtrained, they are at higher risk of being infected by coronaviruses. So the way of transmission of this infection, this is an infection basically, so the transmission is the key. The main way is through droplets generated by coughs, sneeze, and exhales of infected people. And this is why it's really important to keep distance from any person who is affected by COVID-19, basically. And then by touching a contaminated surface, and then touching eyes, nose, and mouth, basically let the virus goes and get access to the lung. There are the ways that we suffer and get infected. This is the most common way, although we have seen even the virus invading a body from the eyes or through the basically by eating the virus. But they are not really common. The most common way of transmission is through droplets that goes inside the lung. The sad fact is that there is no effective treatment for COVID-19 at this time. So we don't have any specific treatment option at this time. There have been many drugs, many names claimed to be effective in treatment of this condition, but none of them is confirmed as the specific and effective option to treat the condition. Basically, the treatment of this condition would be by development of a specific vaccine for COVID-19. And this is the thing, the hope many people have, and many researchers around the world, many laboratories are working hardly trying to make this vaccine, do necessary tests, and come up with a tested working vaccine for people. That would be the treatment. Or if any medication by that time actually shows up that has the function to kill this coronavirus without damaging the body. But the main treatment that everyone hopes for is a vaccine for COVID-19. By that time, what we do is supportive treatment. For mild conditions, they can stay at home, basically resting at home in isolation, try to keep distance from other people, not transmitting the condition to rest of the family members. It's important to have a good hydration and supportive medications to control their symptoms. Having some rest and try to activate and let the immune system control the situation and resolve the infection. It takes up to 3 weeks, basically, to see a resolution. But when there are some emergency condition, we have to transfer the patient, the affected person, to hospital and have some more serious care, basically. So when the patient develops trouble breathing, or when there is a persistent pain on the chest and chest pressure, basically, when there is a confusion, there is an inability to be awakened or to stay awake, and when we see that the patient is going to actually have some bluish lips or face, these are the critical signs, and by seeing each of these conditions, we have to transfer the affected person to hospital for serious care. And the care at this time is more serious supportive care, basically. Initially and most importantly is trying to improve body oxygenation by attaching the patient to ventilator. So ventilator can provide some positive and forceful oxygen, especially for those who cannot afford, their respiratory muscles are fatigued and they cannot continue a good respiration efforts and dynamics. Then the next step is try to reducing the inflammation, the general inflammation across the body by using different kinds of medication. And at very severe and critical points of this pathogenesis, clinicians using strong corticosteroid agents, specifically dexamethasone, try to subside the severe inflammation. We keep them hydrated. The fluid management is important, and treatment of sepsis and other infections that happens and are basically secondary to this coronavirus condition is other treatment importance and priorities. So as we can see, there is no effective treatment, and everything then goes back to prevention. So we have to understand the situation. We have to be very serious to prevent the condition, because when a person is affected, as discussed, treatment options are limited. So there are some general measures that we have to consider as the basis of the prevention of this condition. Stay at home, avoid unnecessary visits and trips in our community because we don't know who is infected around us. Interestingly and sadly, there is a 5 days, minimum 5 days incubation period. It means that people may get infected, and after 5 days, they start to showing the symptoms. They can understand that something is wrong, and they start to having classic and common symptoms and signs. So during the first 5 days, they may actually carrying the virus, transmitting the virus to people around them without knowing, and other people can't No, because there is no signs and there is no symptoms. This is why we have to stay at home. We have to avoid unnecessary trips and visits during this pandemic period. We have to limit contact with others. Social distancing, meaning keeping 2 meters distance from people, is critical. We have to avoid touching people, no shake hand, no hugs, no kisses, no high fives. We have to basically limit the body contact, is critical. We have to avoid sharing personal items. That's another important issue, especially for athletes. They shouldn't exchange or use the same equipment or devices, water bottles, weights, different things. Wearing a face mask is really important. For when it started, initially, we didn't have enough information showing how important it is to have the face mask, but now it is something critical, necessary in many many cities, countries are currently wearing face masks is necessary for any person who actually come out their indoor spaces. And as you can see in this slide, this is the situation when we are not using masks, when 1% basically use one mask, and when both people or all people around, they are using face masks. It can really reduce the droplets, control the droplets, transmission of the droplets and the virus. So wash hands frequently during the day with soap and water for at least 20 seconds. So we have to spend time, basically. Using hand sanitizers, especially the alcohol, the solutions with more than 60% alcohol is really important. So we have to carry these agents with us when we are going outside. When there is a cough or a sneeze, we have to do it into a tissue or in our bent arm, so not our hands, importantly. Avoid touching eyes, nose, and mouth, because we can simply transfer virus from the surface, pollute the surface into our respiratory system, basically. And we have to clean surfaces with cleaning sprays and wipes. These are basics and general measures to prevent spreading the virus. Now, what is most concerning point for us as people in wrestling family community is the effect of COVID-19 on athletic performance, and how to cope with this, how to manage this, and how to gradually get back to our sport. This is what's the burning question and concern for all of us. As I said, and as everyone knows, this is a new condition. This is a new disease, and we haven't experienced this disease before. So the amount of questions that we have in all aspects of disease related to disease is more than answers. So we don't know many things about this disease, and later on, after years maybe, we could actually get a good understanding after studying conditions. But so far, as researchers are hardly working on different aspects of this disease, we have some basic information, very important information. So among them, research results shows that patients who survive from COVID-19 may suffer lasting lung damage. It means that even after surviving the condition, in those people who really pass this condition, even with mild signs and symptoms, the effect on their lung tissue is permanent. So basically, as you can see here in CT scan, these affected area might get actually fibrosis. And fibrosis basically is a tissue which is not functional. So it's a kind of non-functional repair of lung damage. And because of these, as you can see, these area in the lung that loses its functional capacity, we are going to have a lower lung capacity, lower VO2, which is very important in athletes, and therefore lower endurance. It means that being affected by COVID-19 may terminate competitive performance. We don't know this for sure, but from facts and figures, from pathophysiology of the human body and the information we have got so far, it's very likely that people who get affected by COVID-19 may survive, may get back to normal activity without any problem, without any signs and symptoms, doing their daily job with no problem. But when it comes to the maximum competitive dynamic efforts for athletes, the highest competitive performance, it might actually come up with some limitations, especially the endurance. So competitive athletes, including wrestlers, should avoid being infected. This is the most important message I want to present in this webinar. Prevention of the infection should be the ultimate goal. Because if we get infected, if our athletes get infected, even if they can survive and pass this condition, they may suffer from a limited oxidative capacity, which basically terminates their competitive performance. Another piece of information that we have got so far from research, different researchers, is that rate of mortality and morbidity, and basically the complications, the severity of the complications, are higher among those people with delayed diagnosis and supports. So basically, the rate of mortality and suffering from severe complications afterward are among those people who refer to clinics and hospitals after spending more than 5 days, basically 10 days, when they are really sick. So by that time, they have lost lots of lung tissues. It means that early diagnosis of the condition, early insight of possible infection, and it starts investigating, and if confirmed, then early treatment, supportive treatment are really necessary to reduce the complications of the condition and improve the rate of survival. As you know, the diagnosis cycle at this time, it starts with monitoring the clinical signs and symptoms of the condition. So any person with fever, with cough, with shortness of breath, that starts suddenly, they have to go under investigations. There are some blood, or there are some swab-based tests, which is called PCR, and they come back with the results after 1 to 3 days based on the type of the kit that is being used. But the final confirmation basically is by having an MRI or CT scan from the chest area, from the lung tissue. So there are some classic signs that we see on CT scan of affected people like this. Small spots, as you can see, diffuse small spots across the lung, which confirm the diagnosis. Therefore, athletes should do their best, best and maximum protection, and try to consider every possible means to prevent from getting affected. This is the most important thing for athletes. I mean, what I'm trying to say is that in athletes, especially at competitive level, they have to be more sensitive than other people. They have to be more careful than other people. They have to do their best trying to avoid any possible involvement in this disease. A vigilant health condition self-monitoring, therefore, is really important for everyone, because we want to start possible and proper care as soon as possible if we are affected. Therefore, we have to have a vigilant, wise health condition self-monitoring every day. Maintaining physical and mental fitness, especially during this pandemic condition, is critical for our athletes and athlete support personnel even. And for all this, we need to be updated on COVID-19 information. In our sport community, in our wrestling, among our wrestlers, beside all those measures, general measures of prevention, there are some specific points that we have to consider. We have to follow and comply with all guidances by our national authorities wherever we are living or we are practicing our sport, because they are different. The protocols are different based on the severity, based on the level and the type of care, diagnosis of the condition. So they are different in different countries. And we have to be updated on our local guidelines and instructions. There is no specific supplement to basically prevent from this infection. But there are some supplements, there are some agents that we should consider in order to improve and boost up our immune system. And we know that when the immune system is working well, is improved, even if infected by the virus, body can better deal with it and cope with it. So among them, the most important agents that different research has been showing is the vitamin B, vitamin C, vitamin B complex, zinc, and selenium. These are the most important agents that we have to consider in our daily supplementations. Avoid overtraining. That's a very important point in our athletes. You know, something that is happening right now among many athletes, especially elite athletes, is that because they cannot do a normal practice, what they do, they actually spend more time on treadmill, spend more time working by weights or doing some resistive exercises. So they are prone then to get overtrained. And we know that overtraining syndrome is a serious condition that can, again, terminate the competitive athletic, performance. So we have seen many athletes, many good athletes these days that are suffering from overtraining because they spend a lot of time doing exercise out of control, out of a normal protocol. And the thing with overtraining is that one of the main consequences of overtraining syndrome is weakening the immune system. And you can imagine in people, in athletes who are overtrained and the immune system is disrupted, they are very prone to get infected by a virus. Stress management in particular is really important among our wrestlers, especially younger wrestlers. So, as I said, it's really important to have a good self-monitoring. Basically, any serious athlete, any competitive athlete, any elite athlete, regardless of this condition, they have to have a daily self-monitoring, because even if there are going to be a simple common cold, they have to know it as soon as possible and start, at least resting and getting hydrated and using medications to pass the disease quickly. It's more important in this pandemic period, pandemic conditions. So there is a simple instruction I want to basically present here for our athletes. There are 3 measures that any athlete should do every day. At very early morning, before starting the daily activity, any person should actually measure the heart rate. We call it heart rate rest, and write down the number. So every day. Also, after measuring the heart rate, we should use a simple thermometer to capture body temperature from sublingual, under the tongue, or under the axilla. It takes 2 minutes. So we have to write down this number too, the body temperature. Then we start our activity, and we have to try to do a deep inhale, basically, inspiration. We have to be able to fill our lung with air completely. So normally we can do this. Everyone should actually do this test very early morning and just write it down, yes or no. Normally, these numbers, these 3 parameters should be constant in a healthy condition. But if a person one day see that the heart rate rest is more than every day, more than the normal range, the body temperature at the same time is higher than normal, and the inspiration capacity is limited. So person cannot actually have a complete and deep inhale, then this is a very important warning sign for the person. It might be a very early stage of being infected by coronavirus. If we see this condition, we have to seek help and do more investigations. It's really important because if you can actually have a very early diagnosis of condition, based on the research so far, we have seen that we have better options to control and dope and manage the disease and reduce the severity of the complication afterward. Maintaining physical fitness for athletes is the key. So they have to do their regular exercise, if possible, in outdoor area, keeping social distancing, being far from other people, working on aerobic, anaerobic, stretch and flexibility, and balance and coordinations. So sometimes, practicing and spending time on each of these quality is not that difficult and doesn't need very sophisticated equipment. This is the art of the coach and elite athletes to have good, ways of doing all these exercises. In particular, the aerobic exercise is really important because it would be difficult, and time needs time, more time, to get back to the previous aerobic capacity. Therefore, we have to keep it as high as possible. General hygiene is really important. We have to be very sensitive on washing hands, using alcohol to wipe up and clean our hands and surface around us every day. We have to take shower before and after each training session. We have to clean and wipe down any equipment we are using before and after using the equipment. Shouldn't share personal things, equipments, water bottles, towels with other people, even if you think that those people are healthy completely. Only one athlete must use one specific equipment at a time, and after that, they have to clean it, make it ready for using by another person. We have to maintain our physical distancing from teammates, from coaches, other players, especially when taking breaks and during the exercise session. Wearing masks is really important. Masks should be worn in public, outside of a sport, as much as possible. Coaches, staff, spectators should wear masks when they are around us, or they are inside or outside around the athletes. Wearing masks are suggested while athletes are doing some light exercise, but during heavy exercise, it's not recommended, especially using serious and strong masks like N95. Basically, using N95 is not suggested or recommended for athletes. As we know, the best strategy so far is that every wrestler should actually find a partner, a constant partner during this period, and do exercises with the partner. Therefore, it's really important to make sure that the partner, each of these couple of wrestlers, are healthy, are actually negative on the tests, and they are responsible to do their best to prevent from this infection for themselves in the first place, and then for their partners. It's a huge responsibility. So no shake hands, no high fives, no fist bumps or chest bumps or any contact, unnecessary contacts. And even during the exercise, we suggest wearing sports stretch long sleeve bodysuits under the singlet, because as we know, in our sport, we have a full contact between the body surfaces. So if someone is possibly infected, it would be very easy to transmit this infection by body contact. Therefore, we have to reduce the contact as much as direct contact as much as possible. And wearing stretch long sleeve under singlet may be helpful. Besides being vigilant and keeping body fitness, maintaining mental fitness is equally important. This is a new condition. This condition is affecting all people around us in our community. It's not just limited to athletes and sport people. Everyone is kindly affected by this disease, and everyone basically is under stress. For our athletes, for our community, we have to find the best way to spend this time with the best mental fitnesses as much as possible. Keeping contacts between coaches, trainers, and their athletes is critical. Sometimes just a daily quick, talk might be very important and helpful. Using sports psychology consultations is critical, is the key. They can really be helpful to athletes. So we have to seek this service. Doing some routine mental exercises is really important. Research shows that by using right techniques of mental exercise, you can keep your mental awareness and fitness, as well as even improving your physical fitness. I don't want to go into this sports psychology drills and techniques, but there are serious techniques that can help to improve and maintain the mental fitness and physical fitness. This is a very good time for our athletes or even for ourselves to watch wrestling clips. So there is a huge and a very rich library of clips, wrestling clips at UWW and at YouTube. And this is the best time, even, that might be even more effective if athletes with their coaches having social distancing actually watch the clips together, and coaches, trainers try to, explain important techniques, weaknesses, strength of wrestlers in the clips. So reviewing the clips is a very good thing to do. It's a very good time also for reading books, inspiring books that you can find about the story of people, athletes, the secrets of success, dealing and coping with difficult situations. And there are lots of good books, basically. And stay positive. This is a condition, we have to pass it, and we will pass it all together. So we have to be positive and try to even use this condition as an opportunity, not just just a risk part of this condition. Smart people, wise people can use this condition even as an opportunity to improve themselves in comparison to other people who are globally getting affected by this condition. Another important cornerstone during this pandemic period is maintaining proper nutrition and weight control. You know that many people, including athletes, are dealing with overweighting because of the reduction of physical activity. It happens to all people in all professions, including athletes. But we have to be very wise, because we know that keeping a proper nutritional regime, supplementations, and weight control is really serious in our sport. So keeping regular daily aerobic exercise can help us to prevent of increasing the weight, avoid taking carbohydrates, unnecessary carbohydrates, especially the beverages. Most of the beverages are having lots of unnecessary carbohydrates, which is not good for our regime. Keep hydration at the same time, having proper supplementations, and importantly, avoid banned substances. This is another mistake that some athletes are doing. They try to compensate their lack of activity or lack of exercise by using some banned substances, intentionally or unintentionally using supplements that are not really controlled. So, and it can be a danger, because World Anti-Doping Agency and local anti-doping agencies, they are not stopping their activities. They can actually do, out of competition testing at any time. They can come and get samples. And we are very sensitive and serious about doping control. Again, it can be intentionally or unintentionally, but it's really important to do not use not well-known supplements, and know any medications to maintain and improve body function and performance. Regular weight monitoring is really important then. So, returning to training and sport. Look at this up-to-date 2 days ago information chart. So as you can see, globally, the rate of COVID-19 infection is increasing. Sadly, we don't see a decrease, at least at this time. And as far as we see that increase, this out of control condition, when there is no effective treatment, when there is no practical tested vaccine. I mean, holding competitions, doing regular exercise is going to be challenging. But it really depends on what phase of disease is in the current time, at the location of each of us. It depends on local host COVID-19 regulations and guidelines and instructions. And it depends on national and international federations' instructions. We know that UWW is hardly trying to come up with some solutions and protocols to regain and start, worldwide competitions. We are hopeful for that. We are watching on a daily basis the condition, and we hope that we see some declining pattern of this infection in coming days, coming weeks, letting us to plan for returning to our competition. But nothing is really definite at this time. And it's not just limited to wrestling. It's the condition that all sports are having. And it's not just, again, for the sports. Many activities are basically do a daily watch, watching the condition during the, we are in ongoing pandemic condition right now. Until an effective treatment for COVID-19 is found or the vaccine is developed, the wrestler practice will be limited and is certain and cautious. Everyone involved in wrestling should be highly cautious and responsible to avoid transmission of this infection and help for an effective return to new normals. We have to be updated and we have to follow guidelines in a daily basis. When it's time for gradual returning to wrestling, everything will start with medical examination. So we have to make sure that our athletes who are going to actually start the exercise, especially in a kind of teamwork, and in particular competition, they are completely healthy. There is no sign and symptoms of the disease. Their PCR tests are negative and there is no injury. And then we have to start by physical assessment. This is the first step for physical, basically return to sport. The listing is being able to jog for 500 meters on the flat without excessive fatigues or breathlessness. And then we have to do initial VO2 test and continue this test in a regular basis. Then gradual increase in exercise intensity and duration. Intensity and duration. They have to be gradual. So in the best situation, the return to previous performance should actually be done within 3 to 5 weeks. So it's suggested that we start from 60% of heart rate max activity, gradually increase this intensity to 90% of heart rate max, and do not pass this until we make sure that everything is under better control. We don't want to do some overtraining syndrome or overusing injury in our athletes. Psychological readiness to return to a sport is very important. It would be the time for goal setting for everyone, including athletes, and positive thinking and practice would be critical. So COVID-19 is a challenge we have to overcome altogether. I hope for that. And thank you very much. And I would be happy to answer a few questions if there is any.
Babak, thank you very much for this excellent presentation, very comprehensive presentation. I've taken some notes during your presentation because there are a lot of words, a lot of messages to take. I hope it's the same for all attendees. You've told us during your presentation that prevention, protection is still important, and it's even more important for athletes because you've told us that the consequences, for example, for athletes who can have lung damages is really are really serious for elite athletes. So really important messages that you have conveyed to us. So thank you very much. We will take some questions here. Maybe, as you said, there's one question. I'll read the question for you. There is a question for this year World Championship to limit the age of accredited participants to reduce the risks. So basically, is there do we have to make differentiations due to the age?
Of course, that's a very, very good question, and the quick answer is yes. We have to eliminate the risk as much as possible. Therefore, we have to reduce the number of participants and the events, and concentrate on just adults. So as far as I know, the policy across many sports, including wrestling, is that to eliminate lower ages and the higher ages of elite athletes and competitors. This is the same thing at UWW. Maybe you can better provide information, Carlos, about the official decisions on this.
Yeah, for the moment, there's no specific decision on the limitation of accreditations, or I mean on the age or everything. So I cannot add more to your answer. There's let's say a related question. If the question is if any competition is going to take place, will there be a different kind of medical certificate? So maybe this question is maybe also related to the screening of the athletes or before competitions or training. Maybe you can elaborate on this.
Sure. Well, that's a must. We have to make sure that those athletes who are going to participate in our competition at any level, they are completely safe, they are completely negative as much as possible. And it's not going to be a simple medical examination or medical certificate because as I mentioned, I mean, even if you do a test today, it cannot guarantee that in 2 days you are not infected while you are not showing any signs and any symptoms. You don't know yourself, other people cannot appreciate that you are infected. So to my knowledge and to my understanding, we have to come up with some specific protocols of screening and keeping under observation, keeping the athletes, the participants under observation at least for a few days. It can be somewhere between 5 days to 10 days, or even to 2 weeks. In the best scenario, we have to have our participants in a kind of isolated space in their hotels, let's say, or some specific accommodation, and being able to observe them doing some frequent tests, make sure that they are healthy and they are not infected as much as possible, and then let them to start the competition. So it's going to be difficult. It's going to be a new, instruction, a new kind of medical check-in.
Okay. There's one other questions related about what you think about travel restrictions. For example, if the host country doesn't allow athletes or coaches from one specific country, how is the United World Wrestling going to assess the situation? Well, what if I can just give some pieces of information? We're trying to assess and working with all the continental councils, but also the federations, to have as much as possible information. And it's a daily work. We're also in contact with the IOC Medical and Scientific Commission, who are in direct contact with the WHO. So this is also very difficult for us to assess every country in every situation. Of course, if there's a competition in one country, the national restrictions will prevail, and it will be for the national authorities to also assess the situation. I don't know if you want to add to that.
Exactly, Carlos. I just want to echo what you said. It's a very difficult situation, a very difficult decision to make, to first find the proper host country, considering the level of involvement and basically the rate and severity of medical condition in that country. And then for athletes and the athletic support personnel who are gonna travel to the event, is really important, and it requires daily basis observation and coming with updated, let's say, decisions. But I just want to give you an example. I remember not last year, basically this year, somewhere in February, when we were thinking of even still holding the Tokyo Olympic Games, we were thinking, because at that time, China was, the Wuhan basically was under observation, and still there haven't been that much of reported infections and disease in other countries. So we were thinking of, if we want to hold the Tokyo Olympic Games, the group of athletes who are coming from China, they should go under a kind of specific quarantine in Tokyo. And we have to observe them and do the final test after, let's say, 10 days or 2 weeks of their camp training, basically under observation. And those who can pass the PCR test, they can come into the competition. So maybe considering this kind of policies, or a kind of modified policy like this, will let us to hold the competition.
Thank you. There are still two questions regarding isolation. One is regarding will there be an isolation or testing period in advance of a competition? At the moment, we cannot tell really. So it will really depend on the organizers. If there is a competition in one country, we will have to be sure that the organizers inform all the federation ahead of the competition, the conditions or the isolation conditions, and how it will be done in the country or before arriving in the country. I mean, these are questions really that it's really difficult to answer, of course.
at this time.
There's one question. Well, it's more a remark from Ecuador. That even though we take all the prevention measures to not get infected with COVID-19, I still don't see a safety mechanism to start our competition worldwide, because the comment is that an athlete may look healthy and has been tested negative, and the opponent too, but there is no warranty that to prevent the infection. So that's maybe more a comment, but if you want to add something to that.
Well, I agree basically with this comment, and we know that, you know, even at the best scenario, when we are having a negative test in our hand, we don't know what's going to happen tomorrow. If you are getting infected tomorrow or not, especially considering the minimum 5 days, or let's say average, not minimum, average 5 days of incubation period, when a person can be infected without any signs and symptoms and awareness. So this makes it really challenging. And I mean, I can just say that, you know, in this new era, everything is going to be with higher risk. Holding any kind of meeting, any kind of activity is going to have some degrees of risk. The most important thing is try to reduce this risk as much as possible.
Okay, I think there are no other new questions. I've added on the chat of the webinar a link to the UWW website. It's under commissions and medical commission. The guidelines that were published or sent to all federations last week, they are published on the website. Maybe I haven't had the questions, but maybe how about sharing your presentation maybe on the website, Babak, if you would agree. We can, sure, of course. We can also post the slides on the websites. So, yes, please. So yeah, I don't see other questions. Let me just check. Sorry. Yeah, that's it, I think. So Babak, thank you very much for this presentation again, very comprehensive and very interesting. Thank you to everyone, to all the attendees, and yeah, the message, keep on protecting and preventing the spread of this virus, and stay positive and motivated. We hope to see each other very quickly, I hope, during hopefully competitions. Yeah.
Thank you very much.
Thank you.
Cheers. Bye-bye.
Bye-bye. Thank you.